Hi, this is Dr. Bob, Public Health Officer from Douglas County, with another of our Facebook Lives. Looks like I remember the microphone. So it's April the 27th, and we've been doing this now for about 13 months, and we'll do it again tonight. Again, this is a chance for me to answer your questions. So if you put them at Facebook questions at Facebook Live, we'll go Facebook questions at douglaspublichealthnetwork.org. Facebook questions at douglaspublichealthnetwork.org. We'll get them, or you can just put them on the Facebook Live, and Vanessa will pick them up and send them to me. So, as always, we'll start at the top and then move down. It's been an interesting week, really a fascinating week for those of us who study the pandemics. So in the in the world, it has been the worst week ever. So we had the first peak in the springtime, second peak in the summer, third peak over Christmas, and then for some of the world it came down. So in the UK and in Israel it came down, but in the world as a whole, it's really gone up. Over 1 million cases a day for some days in this past week, mostly due to huge spread in populous countries like Brazil, Argentina, Iran, and especially India. So India, a huge country, over 1 billion people. So when we talk about a case rate of 20 per 100,000, 20 per 100,000 is 200 per million, and then you have over 1 billion people. It's 200,000 cases at that relatively low level of spread. And what they've seen is just absolutely very fast spread in that area, most related to variants. And what happens in India is that there are several variants spreading around, 617, B117, and others that are spreading around and spreading quickly. These new variants seem, at least in India, to be very contagious, fairly serious, and it has truly overwhelmed the Indian healthcare system. So India is an area very, very densely populated, some very modern stuff with high-income people, but then incredible areas with millions of people packed together in areas, just exactly the kind of thing we worry about for quick spread. And indeed, they've seen it. And they've run out of meds, they've run out of oxygen, they've run out of hospital beds. It seems like a truly desperate situation in India. However, there's other places that are doing well. Again, Australia, New Zealand, Taiwan, South Korea have kept the case counts low. And Israel and the UK, which previously had very high case rates, are now down to some of the lowest rates they've seen. Now in New Zealand, Australia, Taiwan, and South Korea, that's because they've kept the disease out and have been able to keep the disease out. And we think in the UK and Israel, it's a combination of public health measures and a high rate of vaccines. South America continues to be a problem. They're mostly spreading the P1 variant. And this P1 variant has so many different mutations that makes this a very difficult virus to deal with. It seems to be more contagious. You don't seem to have good protection from previous infection, and presumably not very good protection from immunization. So what's happening in South America is very, very worrisome. The United States is interesting. We had our first peak, we had our second peak, we had a third peak, and it looked like 2 weeks ago we were going to have a fourth peak. That fourth peak has kind of fizzled out, and it's fizzled out at a relatively low number. So while in the U.S. we're still having 60,000 cases a day and 700 deaths a day, which seems like a lot, and it's still hot in Minnesota, Michigan, Texas, Florida, it's not quite as hot as it was before, and it looks like it's calming down again. And that is good news. The bad news in that countrywide is that places like Michigan are seeing a lot more cases in younger people. So this week they reported they had 70 kids in the hospital with COVID. Now in the past, kids had not gotten very, very much affected by COVID, but in this wave, kids seem to be affected much more than previously, and that is a big, big worry. It's interesting because what's circulating in Michigan is the B117 variant, which is the UK variant, and the UK noticed this also when they had their peak, was they had a lot more young people than they'd ever seen before. Hold on to that thought because we're going to get to it in a bit. But overall, the U.S. is looking better, I think because we're having increasing vaccination rates. And I think this is a race between increasing vaccination rates and the variants. So 4 weeks ago, I said we were at a crossroads. And I think we're still kind of at that crossroads here. Are we going to be able to vaccinate enough people before the variants take hold, or are the variants going to take hold before we can vaccinate enough people? And I think right now it's a neck-and-neck race. Oregon is interesting. Oregon has traditionally, throughout this whole pandemic, had a very low case rate and a very low death rate. However, over the last 2 weeks, both the cases and the hospitalizations in Oregon have really, really risen. So when we looked at the hospital numbers, in the first and second peaks we had 200 or 300 people in the hospital, but then it went down. During the big peak we had 400 or 500 people in the hospital, but then it went down to about 100. Now it's back over 300 people in the hospital, many of those in the ICUs. These people who are being hospitalized in Oregon seem to be younger and younger, with fewer older people, because the older people haven't been vaccinated, and the acuity of the care for those people is really very high. Now, this should not be a big surprise. People remember our two youngest really sick people. They didn't die, but they were in the hospital each for over 90 days. They were each on ECMO, and ECMO is this thing called extracorporeal membrane oxygenation. Basically, it's a heart-lung machine that typically you would be hooked up to for an hour while they did your bypass, or maybe 2 hours while they did a complicated cardiac surgery. These people are hooked up to this machine for days or weeks. And there are only so many of these machines. I mean, typically in Oregon, we'd only need half a dozen of them. But during this time, all of these 30 and 40-year-olds who are having this are looking for ECMO. And ECMO is the #1 limiting factor. Now, ECMO is not something you can just buy off the street or just have anybody not do it. This is incredibly complicated. If you're monitoring somebody's heart-lung thing, the machine can't malfunction for 1 minute. If it malfunctions, tube comes out, something gets clogged for 1 minute, the patient is dead. So you basically have to have an OR crew there the whole time, that if something happens, catheter gets kinked, the catheter gets clogged, something happens with the machine, that you can respond absolutely immediately to it. And in Oregon and Washington, we're running out of ECMO capability. Now, I've been told that nobody who needed ECMO didn't get it, but there were times when there was not a single machine left. If one more person needed it, they would have gone without it until a machine freed up. And because people are on these machines now for days and weeks, really, that's something I never even heard of before. Now what's happening is these machines are getting used up. So in Portland, this is a pretty dire situation. In Oregon, high disease levels in Grant County. Actually, Grant County has had more cases this week than we have. Klamath County. And then in the traditional Portland area. Many counties today went back to the extreme range. So they're going to have closure of lots of things because they went back to the extreme range. Douglas County is bucking the trend. So Douglas County has had relatively low rates, and while other people went from high to extreme, we went from high to moderate. We were one of the only counties that got better, and so we got better. But even though our case number's low, 6 or 7 a day, we had a big number today, and we had 11 people in the hospital. That's a high hospitalization number. You know, when we look in the past of what we'd had, people usually are in the hospital a week or so when they have the disease, and about 1 in 10 get admitted. So if you'd looked in the past at the numbers, the daily case numbers and the hospitalization numbers were typically about half the number of daily cases, and that was just because hospitalizations are the number of people in the hospital rather than people admitted to the hospital. So that would be kind of the number. Now, we're 6 cases a day, but 11 cases. So rather than being half of the number of cases, it's twice the number of cases. And many of these are younger people. I mean, I use my age. 65 is kind of the benchmark for being an old fogey. And many of these people are younger than I am. And many of these people are really sick. They're in the ICU. They're on vents. So there's a lot of sickness out there, and it's a little different now because it does seem to be younger people, and it does seem to be sicker younger people. Now, there's a question of, well, maybe this is no different than before, but just because you're not seeing the older people, you're not thinking of the younger people, and that's true. But I think there's something different going on in there, and this would be similar to what we've seen with the variants in other places. So a little bit worrisome there. On vaccines, the good news is that the Johnson & Johnson vaccine was very carefully looked at. What they found was about a couple in a million where people had this unusual clotting. Seemed to be mostly women, almost all people less than 55. And so that was good that they looked at it. I think they'll continue to find a few more cases over the next few weeks. But in general, they didn't see a huge explosion in cases. And they very carefully looked at Pfizer and Moderna, and neither of those had issues with this kind of clotting. This kind of clotting was unusual. So early when this came out, you may remember I said, well, this is funny, because this is not just clots that many of us get when we're older or take birth control or take other things. But this was weird, because these were clots in the veins of the brain, which is an unusual thing, and they had low platelets. And indeed, it comes out that this is an unusual thing. It seems to be an immune response, couple in a million, again, mostly young women. So what should we do with this vaccine? Well, if you are an older person, I think you should get whatever vaccine you want. I chose the Moderna because I didn't mind coming back for a second dose, and it's a little bit more efficacious, and the Johnson & Johnson wasn't out at the time. There are others that may choose the J&J because it's simpler, it's single dose, you're done right away, and so they may choose the J&J. And I think for people 50 and above, it really makes no difference. So at my age group, whether you took the Moderna, the Pfizer, the J&J, safety-wise, they're all about the same. I think for women up to age 50, you'd have to then balance the convenience of the J&J against that small but real risk of a complication. And I think if for a young woman, and if you'd said, I can only get it one day, I'm going to be traveling, I need to get it right now, maybe the J&J would make sense. But except in those rare circumstances, I think the Moderna or the Pfizer likely makes great sense for the people for 18 to 50, especially for women. When we give it, we're going to always offer choice. So it's your choice. We have both. You can get whichever one you want, and it's your choice of which you get. And we did that today, and most people actually chose the J&J, except for a few people, younger women, who chose the Moderna, and that is exactly as I hope. Okay, let me get to the questions, and then we'll see. So Lee says, can you explain the truth about the rumored virus shedding from people who have gotten the non-mRNA vaccine? Yeah, so the question has been always, with any of these vaccines, could you get the disease, could you get the vaccine, and then not get the disease, so not get sick, but just carry the virus in your nose and spread it to people? Early on, the studies were not designed to look for that, but subsequent studies in Israel, the U.S., and other places have looked for that. And indeed, it does not appear that people carry this. It appears that you just don't get sick with it. And when we've looked at it, that's what we see. We see that people who are vaccinated get sick at the rate get sick at a very low rate. So when we looked at our cases in March and April, we've had 624 cases in March and April. And when we looked at those, 2 were fully immunized, 4 were partially immunized, and 616 were unimmunized. And the data is overwhelming that our cases now are overwhelmingly people who are not vaccinated. And when we look at a group that's comparable, say teachers or healthcare workers, almost all of those cases are in the unvaccinated people. So again, you'll remember teachers were eligible for vaccine from the end of January. And so almost all the teachers and educators should have been able to get vaccine by now. And when we look at that, we see that almost all of our cases come from that small number that are unvaccinated. It is so clear to me that this vaccine really, truly works. So Ellen says, we're going on a trip. Be a little careful. So we must travel fully vaccinated, but an RT-PCR is required 72 hours. We're at a loss at where to go. This is a problem because PCR tests are the slower tests, polymerase chain reaction tests. They are really fairly complicated tests, and they can the ones that you do on the bench can take a long time. Now you have to find out exactly where you're going as to exactly which test they'll do it. So Ellen, if you could reach out to me tomorrow, I will look. It's very confusing because some places require a PCR done on a certain machine, some require them done by certain vendors, and so what we don't want you to do is say, oh, get this one, and then find out it's not going to work. So for example, Hawaii has required a test, but it has to be done in a small number of labs, so you actually have to find the lab that does these tests to get it done. So it is very complicated, Ellen. So you can reach Bob at douglaspublichealthnetwork.org. Send me an email tomorrow, and I'll get back to you on a way to do it. There are ways to get it done, but a lot of it depends upon when you're traveling and how you're traveling. So Teresa says, our church used to require sign-ups to attend, but not now. They follow the masks and the distancing requirements. They're not taking attendance. Is it required to take attendance for large group gatherings? It is not required. So Oregon does not have that requirement. Some places, we talked about that in Oregon, but it never came for fruition. What is required is that if you have large groups, that you have someone whose job it is to be sure that everybody's apart and whatever else. And I think that's okay. Again, masking, 3-foot distancing, try not to have singing. Churches have been a source of some outbreaks, but I think that taking attendance is not required. So Bruce says, can you talk about the MIT study on the effectiveness of social distancing? It seems like more a study of aerosol disbursement than a COVID infection study. So this is so fascinating, right? So we have recognized that some of the cases of COVID have spread in ways that don't look like the typical droplets. So when we look at most diseases, they follow a typical droplet pattern. So as I'm talking now in front of these bright lights, I occasionally see a little spittle that comes, and it usually falls on the other side of the desk. And you may remember we did other kind of studies that suggested that visible droplets do tend to drop in 3 to 6 feet, and that's where we came up with the 3 to 6 foot distancing. But we have recognized in this pandemic that some COVID must spread by aerosols, that is, droplets that are small enough that stay up in the air, and they stay up in the air for longer periods of time, and they can go in a long way. And so what this MIT study showed was that in a room with poor ventilation, that aerosols can get in the air and stay in the air for a long time. We know that. So I don't think there was anything particularly new about what was in there. And again, what you want to do is you want to avoid lots of people, you want to have some barriers, and you want to have good ventilation. In this situation, what they suggested was that in the absence of good ventilation, you can still spread the disease across the room, and I think we've known that because we've seen it. Can I review the new CDC mask guidelines? Seems like what Oregon is doing for the last 6 months. And they've been listening to me, what I've been suggesting for the last year. So outdoors is so much safer than indoors. And what they recommended is that people, when they're outdoors and distant, really don't need to be wearing a mask. And I don't. So if I'm riding my bike far away from people, I don't need to be wearing it there. However, if I do stop and get a drink, or if I get in with a group of people, I will wear a mask, and that's basically what it suggests. So that you don't need to wear a mask when you're out there in the wild, but when you're close with people outdoors or in a crowd outdoors, that you might, that you should use a mask. So again, if you're going to be at a political rally or at a protest, or you're going to be in a place where you're crowded outdoors, you should wear a mask. Or if you're not vaccinated, you should wear a mask. But if you're vaccinated and not in a close contact with people, you probably don't need to wear it. Can I tell me what percentage of Douglas County that is vaccinated? So this is a bit complicated because it makes a difference if you're talking about one dose or fully vaccinated, which means 2 weeks after their second dose, or 2 weeks after their first dose of J&J. The numbers in Douglas County are problematic, and the state recognizes this because the data that the state has is by individuals who got vaccines supplied by the state. In Douglas County, we're a little unusual because we have two of the largest federal uses of pharmacy in the state, that being the Cow Creek Tribe and the VA. And what they do is they report their vaccines directly to the feds. Now, we're able to get that data back from the feds, but only in the broadest sense. It appears that, and this is the number, it appears that 7,000 Douglas County residents have been vaccinated at the Cow Creek and the VA. So about 7,000 fully vaccinated at Cow Creek and the VA. Now, you can't be sure because the feds don't always separate it by county, so it is possible that somebody came from Klamath County to our VA and got vaccinated here, and it got counted in Douglas County when it really should have been Klamath County, similarly with the tribe. But we think those numbers are pretty close. By our numbers, there have been 30, so let me get you the full numbers here. So in Douglas County, there are 25,000 fully vaccinated by the state data, and then, as I said, another 7,000 that we think have been vaccinated at the VA and the Cow Creek, for a total of about 32,000 fully vaccinated. Since we have about 112,000, it's about 29 or 30%, which actually is that. If you look in progress, there's 7,602 in progress. There have been 55,000 doses administered in Douglas County, about 15,000 Pfizer, about 38,000 Moderna, about 2,500 J&J. So we've done a very, very, very nice job of getting people vaccinated. So is it enough? No. So we looked at these numbers again, and looking at the numbers of the people who get disease when they're vaccinated versus the people who get disease when they're not vaccinated. If we were to get everybody vaccinated, I know that's probably a pipe dream to get everybody vaccinated, we would be down to less than one case per day. And at less than one case per day, no restrictions. At less than one case per day, probably get rid of masks. At less than one case per day, we really go back to normal times. And we could get there if we get enough people vaccinated. And so that's the key. I mean, all the stuff we do in public health, all the stuff we do with masks works a little bit, but nothing as effective as getting the vaccine. And that's going to be really the key, is getting the vaccine. And so I guess we say is get the vaccine. All right, let's see what we got here for other questions. All right, so Judy says, I want to get together with 3 friends outside. 2 of us are fully vaccinated. Some haven't been vaccinated at all. Should I wear a mask? Well, according to the current recommendations, you should. I mean, the concern being that, well, as I say, the vaccines are great. Well over 90% it appears in our area. They're not 100%, and still the chance that this unvaccinated person would be carrying the disease and give it to you is high enough that I would wear a mask. Now, if they were vaccinated, their chance of having it and giving it to you and you getting it because you're vaccinated is much lower. So we'll see. Yeah, Lindsay says, are hospitalizations after recovery common? 8 weeks after quarantine, ended up in the ER with severe asthma and no previous history. Absolutely. What we're seeing now is that people had COVID, have markedly worse health situations in the 6 months and maybe even a year afterwards. A lot more ED visits, a lot more troubles with other kinds of funny things. Strokes, heart disease, kidney disease, stuff that you wouldn't really expect. So those kind of things are not uncommon at all. Now, there are some people who've never had anything, never even had COVID, and wind up with an asthma attack. But when they look at these, clearly the late sequelae or the late health outcomes that people who had COVID are there. And we're certainly seeing this. There's certainly a lot of people who've had COVID that anecdotally say, I had COVID, kind of got over it, but I have not been the same. I am weak, I am tired, I have this heart stuff. And so I don't know in your specific story, Lindsay, but indeed, overall, we have seen that. So Casey says, do we have an accurate indication of COVID in the county if there's a low level of testing versus higher hospitalizations? So our level of testing has been very similar all along. And again, if the problem was just not enough testing, then our positivity rate would go up. And our positivity rate has stayed reasonably low, well less than 10% during the entire time. So I do not think this is from decreased testing. I think this is from probably one of the variants, and probably one of the variants that causes increased hospitalizations. So what is the status of variants in Douglas County? Well, that is really, really, really disappointing. I will tell you that we don't have that many, we don't have lots of great data on variants. So in Oregon overall, it appears that the Southern California variants, the 427 and the 429, were predominant a few weeks ago, but that now the B117, which is the variant from the UK, seems to be the one that is kind of taken over. When you look over time, it looks like the B117 is the one that's kind of taking over. And when you look at these graphs, it looks like in most areas, when there's a bunch of different ones, it's the B117 that becomes the predominant variant. Again, we've not had any new variants in our county. Let me see if they did one this week. We've not had any new variants in the county for a while. We're sending them, but we just don't have any of the results. So in our region, we've had 13 B117s, 18 427s, 9 429s, and 1 that we knew about before, which was the P1. So it again looks like the B117 and the 18. Now, very different when you go to Portland. So if you go to Portland, they have a lot of variants. Again, mostly the 117 and the 429. So that's it. And it's really Portland where we're seeing a lot of this disease showing up. And their ICUs are full, and the number of people in the hospital is really a bit worrisome. Are we having any breakthrough cases that are being hospitalized? So of the 6 that we looked at, 1 person was hospitalized, and we did have some breakthrough cases when we had breakthroughs at our nursing home. But in general, the people who are having the breakthrough cases are having relatively mild disease. But there's so few of them, 6, that again, the denominator is small. But again, the vaccine seems to be incredibly effective at preventing disease, and because it prevents disease, also prevents hospitalizations. So are there any updates on the vaccine for children younger than 16? Yeah, I keep asking this, and I've been saying for a few weeks now, anytime now. And anytime when I say anytime now, that means, who knows? They say anytime now. I heard today that it was going to be early May, but again, until I see it on the schedule of the ACIP advisory panel, I really take that with a grain of salt. Again, the thought is that it'll probably be May or June when we have vaccines for 12 to 15-year-olds, and that we'll have vaccines for school-age kids probably in the beginning of 2022. So Alan says, who administers the monoclonal antibody therapeutic drug in Douglas County at this time? Well, this is one of the incredible failures of our nation's response to COVID. So early on, we knew that monoclonal antibodies might be an answer to what goes on. So early on, these monoclonal antibodies were made. And what monoclonal antibodies were, so that if I get infected with something or get a vaccine, I'll make for this one about 50 or so different kinds of antibodies to the spike protein. So early on, what they did was they found 1 or 2 antibodies that were most effective against the spike protein, and then grew those antibodies in the lab, and then they would give you these as an infusion to help fight off infection. These were thought to be the ideal drugs for nursing homes or other sick people who would get this. If you were in a nursing home, they test all the time, so they would find out the people who had the disease very quickly. You're already in the nursing home, so you're not exposing new people. You're in a nursing home, so they have nursing care that could give you an IV, and you need to be watched for a few hours, and you're going to be in the nursing home, so they could watch you. So this stuff was set up to be given in nursing homes. However, in the fall of this year, a number of influential people got this monoclonal antibody, and what they said is, this isn't going to go to nursing homes, this is going to go to anybody who wants it. Well, what happened then is it didn't go to anybody. It didn't go to nursing homes or anybody who wanted it, because it's a difficult infusion. I think there is only one place in town that is set up to do it, and I'm not even sure that they've done any in the last few weeks. So again, if there's somebody who is sick, the ideal candidate for this is somebody who is high risk and not yet very sick, because once you're hospitalized, this drug is not indicated. This drug is indicated for people who are early in the disease and are getting sicker. And there's one place in town, I won't say that place because I'm not sure they're still doing it, but if people have questions acutely when it happens, we'll see if there's a place that does it. But this has been a terrible problem, because had we really gotten this going in December for the nursing homes, we could have saved tens of thousands of deaths, and we didn't get it going in. And I have lots of regrets about what happened during this pandemic, and this will be one of the biggest regrets. So Laura says, my friend had COVID around Christmas time. Great. She got her first vaccine and said she doesn't want to get a second since she already has some natural immunity. Is that okay? Well, so the story is a natural infection does give you some protection. It's probably 80% effective, so pretty good. And it probably lasts 6 months or so. A little hard to know if it lasts longer than 6 months, and a little hard to know if it's more than 80%. So about 80% protection for about 6 months. The vaccine, especially if you use one of the mRNA vaccines, gives you over 90% protection and goes out to 9 months. So the recommendation is, if you had COVID around Christmas, you should get your first vaccine, then you should get your second vaccine and be done with it. And so that would be. Now, is this better than never having COVID and never having any vaccine? Sure. And again, just like I'm never going to say something is totally safe or totally unsafe, I'm never going to say that anybody is fully protected, because we have no way to know. Clearly, having had the disease and clearly having had one vaccine, you've got more protection than if you'd not done this. But to get the optimal protection, you should get the second dose. And that's what we're talking about, is just optimizing what you could do. A couple other things that have come up. So one of the things we heard was, I don't want to get this vaccine because I want to wait until FDA gives final approval. So the reason they don't have final approval is you have to have 6 months of safety and efficacy data before you can get final approval. And so these things have only been out now. They came out in November, so then right now they have 6 months of this thing, and so they couldn't file for final approval. But we think in the next month Pfizer will, and the month after that Moderna will file for final approval, and there's no reason to think they won't get it. So if you're thinking that I want to wait until final approval, I don't exactly understand that, but if that's one of your sticking points within the next month, there should be final approval for the Pfizer, and then a month later, the final approval for the Moderna. Some people say, well, I want to wait and see if there are side effects. Again, with vaccines, almost all the side effects show up in the first week or two, and certainly within 2 months. Again, those first 4 months of people have already been through their 2 months, and those first people have been through 6 months, and there's nothing new coming up in those people. So, if your story is, I want to wait until there's some safety data, the question is, how long would you wait? 6 months, 8 months, 10 months, a year? The problem is, if we wait too long, some of these variants are going to come in, and they're going to make it really hard for us to bring this back down again. One of the other things that we had looked at along the way was that people were concerned that this vaccine was somehow rushed through. And yeah, it did go fast. So typically, the story on vaccines is that somebody comes up with an idea for a new vaccine against a new thing, and they do some studies, and they do phase 1 trials. The phase 1 trials typically are a small group of people looking for safety and hints about efficacy, and they do that, and then they wait to see what the results are, and then the results look good, then they line up investors to get the money to go ahead and do the second line. That takes 6 months or a year to do it, and then they do a phase 2 trial, and then after the phase 2 trial, they do the same thing again, and then they get to the phase 3 trial, and they line up some people and they get it done. So in a typical situation where a vaccine is being developed by a drug company, or any drug is being done by this, it takes a while to do this because they're not willing to go ahead and put money for a phase 2 trial if the phase 1 trial didn't work. And so that prudent business sense says we should wait until all the results of the phase 1 are in until we put any money to the phase 2. Totally get it. Makes sense for other things. What did they do for this? Well, what they did with the warp speed is that they cut down the financing period, because what they said is, we'll tell you right off, we're going to fund all 3 phases. And if it doesn't work out, we'll just be done with it, and we'll be done with it. And actually, some phase 1 trials didn't make it. Right, so they gave money to do these phase 1 trials. There was an Australian vaccine that did not work, and so they got rid of it, and then there were some other vaccines that didn't work, and they just basically got rid of them. But what they did to speed this up is they got rid of the funding in between by using federal money in the warp speed project. But the phase 1 trial, the phase 2 trial, and the phase 3 trials were done just like you would otherwise do trials. So there was rushing in the financing part. Who cares about that? There was no rushing through the safety parts and through the other things that they did. And in fact, for the phase 3 trials on these vaccines, they were big. So when I look at the phase 3 trials for other vaccines we've used in kids, like the rotavirus vaccine and the meningococcal vaccine, their phase 3 trials were much smaller, and yet they got approved. These were really large, very nicely done phase 3 studies. And again, a tiny risk like the J&J, you might not see in the phase 3 trial, but then you find that in post-marketing analysis. So after it goes out, then you find it. So I think these are as safe as you're going to find. And when you look at some of the other risky things people do, I think this wringing of hands over the safety is more than it's called for. I mean, I'm a very cautious person. For anybody who knows me, I don't ever drink and drive, and I don't speed, and I don't skydive or do any risky things like that, because I'm a fairly risk-averse person. But I think when I look at the risks and benefits here, the risks and benefits for me to get a COVID vaccine are at least 1,000 to 1. So my risk of dying of COVID in this next year, if COVID continues as it is going, is 600 or so in a million. It's not 100%, but it's certainly not zero. My risk of having a side effect from this vaccine is far less than 1 in a million. So it's 1,000 times more beneficial than risky to get this. Now, for others, it may not be the same, but certainly if we're talking about people 50 and above, given the amount of disease and the amount of death we've seen, it makes all the sense in the world to do this. So I'm just pleading with people to do it, because if we did this, let's say we could get our vaccine rate to 70 or 80%, really our number of cases would go down to 1 or 2 a day, and at 1 or 2 a day there wouldn't be any restrictions. At 1 or 2 a day you really could get rid of masking. At 1 or 2 a day you could put this on the back page of the newspaper, where you'd only hear about occasionally. I mean, we have a lot of other diseases out there that we have 1 or 2 cases a day and an occasional death, right? Because we would have 1 or 2 cases a day, maybe 1 death a month. Well, there are a lot of other diseases that we have 1 or 2 cases a day and 1 death a month, and it does never make it to the newspaper. But when you're having 700 deaths a day in the country, when you're having 11 people in the hospital at a time in Douglas County, those are the kind of things that you really need to get this down. And again, the variants are really the concern. When I see what's happening in Brazil, when I see what's happening in India, largely due to the variants, it really worries me that if we don't get this disease down, it's going to come back in the U.S., and then if it's a variant type, it's going to be really, really hard to do it. So somebody said, I had the J&J in March, will I have to get a booster? So there's been a lot of concern about boosters. So some of it has been a little bit of lack of clarity in the thing. So when you get a 2-dose vaccine, the Moderna or the Pfizer, the first dose is called the prime dose, and the second one is called the boost dose. So we shouldn't use the word boost and booster, but we did. So it's prime for the first dose, boost for the second dose. Now the question is, will you, a year from now, 2 years from now, 5 years from now, need a booster? Like you do for flu every year, like you do for tetanus every 5 to 10 years, like you do for other diseases where you occasionally need a booster to boost your immunity. We don't know. It's probably at least 50-50 that a year or so from now that the vaccine efficacy will fade a little bit, at which point you'll need a booster. The other thing that may happen is that new variants may come in which are not as well treated by the vaccine, and you'll need a booster to make up these new for these new strains, kind of like we do for the flu each year. So I think there's at least a 50-50 that you'll need a yearly booster for this, like you should have a yearly booster for the flu. Again, that's no reason not to do it now. I mean, you wouldn't say, I'm not going to drive a car now because I have to replace the tires in a year. I mean, you're going to drive the car now because you want to drive the car now, and when you need to replace the tires, when you need to replace the tires. And in this case, you need to replace your immunity whenever you need to replace your immunity. And so it's not really a reason to delay on the vaccine. The problem is if you delay on the vaccine and the variants get here, then the vaccine may not work as well, and that's the big concern. Right now, the vaccine seems to be working incredibly well. I mean, again, when I look at it, 600 unvaccinated and 6 who are vaccinated, oh my goodness, that's a phenomenal efficacy of this vaccine, and I would encourage people to get it. So, and when we talk on our cases, we have 15 today, all unvaccinated people. And so again, all these people have been, all of the people we saw today at least, had the opportunity to get the vaccine, so please get the vaccine. All right, let's see if there are any more questions. We're getting to the end here, so we'll give another minute or two. So again, we had a big event this weekend. We did 924 doses at the fairgrounds. No serious reactions. It worked great. I don't think people waited more than a few minutes. We're going to do it again on May 15th. Again, it's open for everyone. So the vaccine at this point, originally it was a bit confusing because, it was phase 1A, group 6.6, bullet 11. It was a little hard to tell whether you were eligible or not. And there was a lot of worry about how these things were interpreted. It's easy now. If you're 16 and above, you're eligible. So it's easy. 16 and above, you're eligible. Please come get it. And we'll do that. So we're going to do it again on the 15th. In the meantime, we have vaccine at many clinics around. Most of the pharmacies in town have it. And there's a couple of the pharmacies were telling me today that they have vaccine and they just don't have a lot of people looking for an appointment. So if anybody is looking for an appointment for vaccine, please tell them to come get it. Now, some of the areas of the state have not done so well in meeting the local need. And so if you know people from other parts of the state who haven't gotten a vaccine, come get it. You don't have to be a Douglas County resident. Anybody can go ahead and get these vaccines. So we're going to start a little campaign this week called It's Your Turn. People in the past had worried that, well, maybe it's not yet my turn. I can't go through those complicated sequencing things, so I'm just going to wait until it's clear. It's clear now. If you're 16 and above, it's your turn. The second was that there were some people who very magnanimously said, well, I don't want to get it now if there's some older, sicker people who need it because I'm relatively young and healthy, so let me wait until they've had their turn. They've had their turn. Now it's your turn. Some people have worried that this vaccine is just out. It's just brand new. I don't want to be the first on the block to get it. Look, it's been out 6 months now. Over 100 million people with this vaccine. I'm not sure how much more data people want on this, but the data is incredibly good that it looks much safer than I thought it would be and much more effective than I thought it would be. So again, if you've been so sitting on the fence, it's really your turn. There are some people who've said, well, we want to be sure that there's enough vaccine for every place in the country. There's plenty of vaccine for other places in the country. In fact, some states are turning down vaccine. So there's no reason at this point to think that there's any scarcity. If you want to get it, please go ahead and get it. And again, if you don't believe me, and a lot of people won't believe me, they say, you feel you're a spokesperson for the state or the county or whatever else. That's okay if people don't want to trust me. I have my own patients, and I think hopefully they trust me. But if you worry about this, talk to your own doctor. I mean, I've talked to many of the doctors, and I won't say all of them, but many of the doctors in town. And I think all that I have talked to, in fact, I don't know of a single one that I've talked to who has not been a fan of the vaccine. Even people who we disagree with little parts of this thing, right? The use of hydroxychloroquine or other kinds of thing that we've disagreed about, and we're allowed to disagree. We haven't disagreed about the vaccine. I've yet to find one of the doctors in town who's disagreed about the vaccine. Almost all of them have been adamant about it. They've been giving it. They've been setting up clinics to do it. Now, some do have concerns, for example, about J&J and younger women. I do too. Some of the people have some concerns that they're going to, they have patients who wait for the final approval. That's fine. It's going to be coming in the next month or two. So again, it's time to get the vaccine, because I think if we get the vaccine, we really get past this. And this is my goal. I want to get past this. I want to have a regular fare. I want to have school opening so that the kids don't have to be wearing masks and having these funny hybrid learning things, which are really hard on the kids. So every Tuesday and Wednesday I'm in the clinic seeing kids. I saw a bunch of teenagers today. I just love teenagers. But a lot of them are struggling. A lot of them are struggling with, they're not getting very much exercise, or, we've been crying for years about limit your screen time, and now we're saying, oh, don't only limit your screen time, stare at your screen for 6 hours when you do hybrid thing. And we know that's not good, because they're probably doing a few hours of classwork, and then they're probably doing other screen time. So they're doing it for many hours, and we're seeing these kids not get outside, not get the activity and physical activity they need. So I really want to get past this. And there are two ways to get past it. One is to say, don't worry about it and let's just have this go. And just don't worry about it because these kids are at big risk. What we're going to see then is a lot of cases, and a lot of older people get sick and be hospitalized, and we're going to be dealing with this for years. The other way is, let's get people vaccinated, get the case count down to 1 or 2 a day, and then you don't have to be looking at my sorry face twice a week on this. We'll talk about other kind of things or nothing. And that's really what we're looking for. We're really looking to get past this. And the way to get past this is by vaccination. So again, I've said too much, but really, 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 it's time for people to get vaccinated. Now, I do know that when somebody's had a strong opinion and now they have to leave that strong opinion, that is hard. It's hard to say, oops, I've reconsidered and I've moved to something else. And in my life, this has happened a number of times where I've been adamant about something, and then a few years later I learned better. And okay, I guess I'm going to go ahead and do that. And so I think there's a couple of things to do. One is that when they do that, the worst thing to hear is, I told you so. And so please, if you have somebody who's decided not to get a vaccine and now they decide to get the vaccine, please don't say, I told you so. Or if they get sick because they didn't get the vaccine, please don't say, I told you so. And on the other hand, don't rub it in like, oh yeah, I told you all along you should have gotten it, and now you got it, don't you feel stupid? Don't do that. What we should do at this point, we should just be supportive of our friends and relatives and neighbors, and we should just want to get past this. And again, far and away, the best way to get past this is for everybody to get vaccinated. So it's your turn. All right, I've talked too much. Dr. Bob Dannenhoffer, Public Health Officer, please be safe and please be kind, and we'll do this again on Friday. Thank you.